is Dr. Kate Eckert, and today we're going to discuss how some of our therapies can help for student athletes. And this could be all the way down to that elementary level, really any age group. So a lot of times we see those super younger set of kids, like my own kids are 6 and 8, and I have used laser for them when they've sprained things like an ankle, or actually the laser helps with wound healing as well. So I've used the laser on them when they've had a really bad cut, and it just really speeds up the healing time for those kind of things. One of my friends is a veterinarian, and she has been using a laser in her office for over a decade, and she said she always uses the laser after surgeries to cut down on infection rate and healing time. So there are parallels with veterinarian field and laser and the human field with laser. She has mentioned to me that she's not sure why that is not standard of practice in wound care clinics, because she finds it to be that helpful with healing wounds. So any big road rash, those kind of things for kids, the laser is really good at speeding up that downtime that you have with it. Very good with the sprains as well. So that is super safe to do on younger kids, and I've used it on my own kids as well. I'll also use it on their sinuses to help with inflammation in that cold and flu season that we struggle with sometimes. Now with Shockwave, the youngest kids that I've worked on that with were about the 8-year range. Two of the things that pop out in my mind that I've worked with on kids that young are Sever's. It's a type of condition in kids' heels. There's a great research study out of the Children's Hospital in Philadelphia where they used focused shockwave, not radial, on children with that condition and had good success, and we had good success with it as well. I've also used it on some kids with headaches. So we use shockwave very superficially. The great thing with our shockwave is it is super specific in the depth that we treat. So with headaches, especially if they're coming from anxiety and those kind of things, we clench our teeth a bunch, and the masseter and the temporalis get very tight, and that can lead to some tension headaches. So we shockwave in certain areas and then laser in certain areas to help reduce that. It's great for people that have tried all the things, and you don't want to put your kids on a bunch of medication when they're super young. We have seen good results with that as well. And with adults too, I use that. That's probably my most life-changing thing I've done with Shockwave, is manage my headaches better. I get really stressed out, small business owner, small kids, just can be a lot, and Shockwave and laser combined along with meditation and some other tools to kind of manage those issues really is helpful. We're considering adding in craniosacral therapy once a week with our headache packages, because we feel that that could be also a very good addition to treating that. But those are all super safe, gentle for children. There are some things we watch out with, and we're very mindful in where we use them at with growth plates and that kind of thing, but we're aware of those issues and we work around those issues. The other thing that we see a lot of kids with for high school age or middle school is they're starting to be more contact driven sports and those kind of things. So collisions, that kind of thing, we'll use laser on when it's super acute. If they have a repetitive strain issue, if they're runners or throwing sports, those kind of things, and they're overdoing, say, a hip or an IT band or a shoulder, those are all things that we work on with those student athletes all the time. Knee issues, big thing that I've seen with girls basketball, there is this correlation with girls with those lateral movement sports blowing out their knees easier, and it all has to do with the physics of your body. So with girls, as their hips get a little wider, it makes the Q angle a little bit more intense, and that puts more pressure on the knee, and that's what makes them more likely to tear a knee. And we want all of our joints moving as mobile in their normal range as possible. So one thing I've seen when watching some of my friends' kids play girls basketball specifically is that they wear ankle braces. And I thought that was interesting. I hadn't watched girls basketball in a while, and I said to my friend, is there an epidemic of ankle sprains out there? Because almost all the girls were wearing them. And she said it was more preventative. Now I would never recommend that. And I said that with the reduction of motion in the ankle, your body is super at adapting, and it will get the motion that it's missing from the ankle being in an ankle brace somewhere else. And usually it's the next joint closest, so that's the knee. So wearing ankle braces is going to make you more likely to blow out a knee. So if you're injured enough that you need to wear an ankle brace, you might want to take a few games off. You should come in and get laser. You should keep those ankles super strengthened. Do not wear them preventatively. That is a good way to weaken your ankles. I would stay away from that a ton. So you should definitely come in and see us for laser. If you have sprained your ankles repetitively, and it's really easy to re-sprain the same ankle, you should come in and get Shockwave. Because once you've sprained it a few times, or even one bad sprain, it's going to swell, it's going to overstretch the tendons, and it's going to leave some fibrous adhesions around the area. It's the body's way of kind of protecting itself, but then it doesn't function the same way. So we use Shockwave after that's become a more long-standing problem. We use Shockwave to break up those adhesions, drive more blood to the area, heal it, and then regenerate it. We make sure that we do a few different spots because usually people think it's an ankle issue only, and we trace those muscles all the way back up to their origins. And people are always shocked because they're like, oh, that did not hurt, or I didn't think that hurt. But they have a lot of achy spots from the Shockwave in those correlating muscles. So if you're only treating the ankle from repetitive strains, you are missing the boat. You're not doing the complete treatment. So those are other things that we can help with, and that regenerated ankle is going to be less likely to be sprained down the road. So even if you're an adult and you had a lot of high school sports in your past and you've had chronic sprains, now you're wanting to just jog on the weekends, but you're having ankle pain, they're usually tied together, and we can treat stuff that's 20, 30, 40 years old. It's still going to respond positively. Those fibrous adhesions do not go away on their own. They don't miraculously over time wear away. They stay there until you physically break them down with something like Shockwave. That's not something you can get rid of with Graston, which is the metal scrapey tools. It's not something you can get removed with muscle work, like with your hands, something else that I do in the office. Those fibrous adhesions are way too strong to be removed with your own physical force. They can withstand so much more pressure than that. So the only way to physically get rid of them is with the Shockwave. That's what makes it so unique, so different from other sound wave therapies like ultrasound, that kind of thing. It's just on a level all of its own. With shoulder or knee stuff where your student athlete has maybe a partial tear, we can actually go in there and regenerate and help with that, heal that tendon, as long as there's something left. If it's totally torn off the bone, you can't make something out of nothing. That wouldn't work for it. But if it's just a partial tear, we can make some really good changes. We can give them some exercises to make things more balanced and help them prevent injuries after that. Swimmers are another one that will typically have some shoulder issues. All of those things respond really well to Shockwave and laser. And what's great about being young is their cell turnover is very much quicker than an adult's, and they heal faster. Typically with Shockwave, we want them to rest as much as possible, and it's always an individualized plan because not everybody's going to respond to it in the same way. So some people might need more rest than others. And we will always say that it takes less treatments to fix it if you're resting, and more treatments to fix it if you want to continue playing your sport or practicing. So you just have to keep in mind, what are you willing to pay for? You know, some people, adults, I've told them that and they say, I don't care, I still want to play pickleball. It's going to take maybe twice as long. It's going to still work, it's just going to take longer. So you have to decide what is worth it to you, quicker healing or still doing your sport. Same thing for kids. So we do have people that get treated and are still able to stay in their season. If this is happening at the beginning of the season, you want to jump on it as soon as it happens. It's so much faster and so much easier to fix something as soon as it starts to bother them, rather than wait until they're in the midst of a competitive sport where they're really pushing themselves, pushing their limits. We do an acute flare-up treatment kind of a thing where we combine the two therapies, and that's good for an acute injury. And those are all things that we can discuss with you or have the front desk discuss with you. The nice thing about our front desk is that they've all gone to the trainings for the therapies that we do. So they've been trained on our machines. They know how they work. They know the science behind it. So they are pretty good at answering your questions. But if you can't get the answer that you want, you can always talk to myself or one of the techs to see what would be best for your student. So we see a lot of kids, a lot of teenagers, a lot of athletes, and we can help them get the most out of their activities, and we love to do that. They're fun to work with. If you have any questions, let us know.